It's a matter of insurance presented by the New Hampshire Insurance Department. Have questions about your insurance coverage? Our Consumer Services Division is here to help. Call them at 1-800-852-3416, email consumerservices@ins.nh.gov, or visit our brand new website at insurance.nh.gov. Granite Staters spend more than $13 billion a year on healthcare, but what exactly does that money go towards? nhhealthcosts.nh.gov is a website put together by the New Hampshire Insurance Department, and today I'm joined by Dr. Jason Aziz, our Director of Health Economics, to talk about the brand new total healthcare expenditure model that we have released. Dr. Aziz, thanks so much for joining me today.
Thank you, AJ. So nice to be here with you again.
All right, so specifically, this is looking to create a data-driven breakdown of healthcare spending in the state based on actual observed expenditures from payers across the state. So to start off with, where exactly did the data come from that you used to create this model?
That's a great question. We're really proud of this new metric, and we think it's very useful for the state and all the different policymakers that do great work. These data came from a variety of sources, just like all of your healthcare expenditure is attributable to a wide array of different entities. So insurance, how much does it cost to administer the health insurance benefits? Hospitals, they're key producers of the healthcare services that we all consume. They represent over 50% of our healthcare expenditures. So how much did our system spend in inpatient settings and outpatient settings? Also, doctors and nurses and physician assistants, those are healthcare professionals. And then other types of things like prescription drugs, and also non-claims payments to public healthcare payers like Medicare and Medicaid. Collectively, we add all of that up and come up with this really interesting macro transparency metric called total healthcare expenditures. And there's actually many other states that have endeavored to assess this and monitor this over time. And monitoring is the key word here. This is often very useful to measure healthcare cost growth, which we know that it's not shrinking, it's always growing, unfortunately, but we can monitor and measure growth so we can keep control over these, because indeed, healthcare costs at the household level are starting to consume a greater and greater share of total household expenditures, and that brings up the concept of affordability, which is really important for all Granite Staters.
How is this presentation of data different from other models? There's some other organizations out there that put together other models that show the cost of healthcare. How is this different?
That's a great question, and we laud the efforts of a lot of different colleagues throughout the state doing good work. So the federal government has a set of measures referred to as the National Healthcare Expenditure Accounts. The federal government measures this across the entire nation, but in each and every state, how much that citizenry may spend on healthcare doesn't vary a little. It actually varies mightily. So there's a lot of interest in looking at in-state measurement, direct measurement in your state for all of these metrics. So the National Health Expenditure Accounts can be population adjusted for each state's population representation, and you can come up with a point estimate. I think the Kaiser Family Foundation estimated that in 2020, New Hampshire spent about $11,500 per person on health care, whereas our metric is actually more modest. It's about $9,300 per capita expenditure in 2022. And the reason for that difference is because we actually measured directly through the markets, healthcare provider markets, health insurance markets, prescription drug markets. We measured directly using observational data how much those expenditures actually were versus using a predictive model to do that. So we're proud of the work that we spent about 12 months foiling and toiling and validating data to ensure that we had the most precise and accurate measures across all different lines of business to give our legislature and the different state agencies and the citizenry really, really robust and valid information on this key important area of healthcare.
And one of the aspects of this report includes the New Hampshire healthcare dollar. Can you talk about a little bit what it is, what it shows Granite State consumers, policymakers, anyone of that nature?
Right. I mean, this is one of my, I guess I'll call it a soapbox, using a dollar graphic to represent to an audience, to a reader, to a citizen, or even a legislature, where our expenditures go. And what's great about the dollar is there are 100 cents in a dollar. And so proportionate expenditures lend nicely to a healthcare dollar. My euphemistic and silly statement sometimes is, we don't buy healthcare in pies. So a pie chart isn't necessarily sufficient to be reporting, how we distribute our healthcare expenditures. A dollar is perfect. So we're proud of our New Hampshire 2022 commercial healthcare dollar that partitions every dollar that a New Hampshire citizen spends on healthcare by the service category for which they spend it. For example, inpatient facility, outpatient facility, and professional charges represent over 80% of the total expenditures, not just in New Hampshire, but frankly, any state and throughout the nation, indeed. And then other things like prescription drugs, which is attributable to almost 20% of the healthcare dollar, and other types of medical and non-claimed expenditures, they're all part of that healthcare dollar. And it really can be useful to break it down at that level of granularity for the policymaker or the industry person, or just the person who's really conscious of how they spend their own healthcare dollar to know where it goes. There are a couple, key metrics in there that we wanted to always point out is that approximately 52 cents on every healthcare dollar is spent on either inpatient or outpatient facility. And that's a whopping amount. And in the interest of responsible interpretation, I did want to point out that healthcare delivery does require substantial physical resources, things like MRIs and X-ray machines and hospital beds and IVs, IV carts, blood pressure cuffs, and all of the types of things that our great clinicians and healthcare systems required to deliver this high-quality care that we as Americans and Granite Staters appreciate. Those expenditures are embedded in those two metrics. So, it's only responsible to point that out. Another key, and frankly I find it astonishing, metric in the healthcare dollar is that only 28 cents on the dollar is actually spent on healthcare professionals. That's your good doctor, the nurse practitioner, the physician's assistants, and all of the other types of clinical support that you get at hospitals or at independent outpatient clinics. Those are the people, the hands-on care that you get is reflected in there. And, it's quite surprising that it's such a small fraction of the healthcare dollar. And I think it's noteworthy to point that out. The last thing I'll say is prescription drugs, as a share of the healthcare dollar, are ever increasing each and every year. And this is a trend that we see in other states as well as nationwide. And in 2021, I think it was 18 cents on the dollar was spent on prescription drugs. Now it's 19 cents, and that share is going up. One noteworthy component of that metric is that only includes retail drugs. That actually excludes drugs that are called clinician-administered drugs, oftentimes high-cost specialty drugs that are administered at some clinical setting that a patient can't on their own administer. Those are not even included in the prescription drug measure here. What's noteworthy about that is that those specialty drugs are becoming a large cost driver in the overall healthcare system. So I wanted the audience to be able to interpret it that way.
Can you break down a little bit on what you mean by inpatient versus outpatient? Obviously, there's a huge difference between what your health insurance is going to be seeing as the cost.
So, yeah, and we have our methodology is published on our website along with these key metrics. So you can see the definitions for inpatient facility and outpatient facility. So to break it down the way you've asked is inpatient facility is any type of inpatient admission. So if you go to the ER and you get admitted, it's an official administrative process. You become admitted to the hospital, you get a bed, you get your own room. There are actually type of charge on the claim form that's called a facility charge. And in there are all of the types of charges that a facility needs to charge the patient to cover their costs of providing healthcare services. So that's the inpatient. Outpatient facility, which represents a greater than twofold share compared to inpatient facility, actually is a much broader category, and in each and every state that endeavors to measure total healthcare expenditures, outpatient facility is the number one source of growth of healthcare costs in each state. But it's important to interpret that the right way as well, because we notice that there's a lot of primary care and urgent care and other types of specialty care settings that fall under the classification of outpatient care. We go to a lot of hospital-owned facilities to get outpatient care, things like dermatological care, radiological care, even colonoscopies. They're not performed at the hospital, they're outpatient procedures. And many types of ambulatory surgeries are also outpatient procedures. So it makes sense that they are a large fraction of the healthcare dollar, and as such, we need to be able to interpret that the right way, because oftentimes those are very efficient ways to deliver healthcare, important types of healthcare to our population. So it is also at the same time a reflection of how healthcare delivery has evolved since the Affordable Care Act, but especially over the last 20 years.
Now, the New Hampshire Healthcare Dollar is a super high-level look of a very in-depth total healthcare expenditure report that is published at nhhealthcost.nh.gov. What are some other key highlights from the report itself that you want listeners to pay attention to?
So, as I mentioned, we're proud of this work. It was our first year to get metrics on this really opaque measurement. We call this a macroeconomic healthcare transparency viewpoint, meaning we're looking at the entire system. We also are proud of and weigh heavily on our microeconomic transparency endeavors that are reported on New Hampshire Health Costs, where patients and employer purchasers can go there and find what they might expect to pay for lots of different types of healthcare services by insurance type and by New Hampshire provider. That's important. That's a microeconomic transparency. So taken together, I think they work synergistically to help inform all people in the system, consumers and producers and citizens and legislators and policymakers, about how much the healthcare services are costing. There are a few things that I want to point out. The value of this metric grows for every additional year that we get a total healthcare expenditure value and a per capita value, because we can measure healthcare cost growth. For example, statistically, it's not a valid value because you only have 2 points, 2021 and 2022. But those are the first 2 years that we've measured. And we see from 21 to 22 an increase of total healthcare spending by about 1.8%. It will be very interesting to us when we get the final estimates for 2023 to now start measuring the slope of that line of what seems to be always an increase. How much does that growth over the 3-year span? And for every additional year, changes in the trajectory of the slope of that line will say something in of itself, independent of where the expenditures are being driven from. So we look forward to that. And we also look forward to hearing feedback from all of our colleagues in different state agencies and the legislature in New Hampshire on how we can best operationalize this useful instrument that frankly has some complexities to it and may require help with interpretation, which I think is in part what we're doing here right now, right, AJ?
Yes, definitely. So an important aspect, especially in the American healthcare system, is who is the payer, whether it's Medicare, Medicaid, the private insurance industry. What sorts of metrics are you able to look at in this report regarding those?
Working at New Hampshire Insurance Department, we see a lot, and we are very aware of payment disparities between what we call the public payers. That would be, Medicare Advantage, and New Hampshire Medicaid. Those public payers serve a great benefit to our society. We need those, but at the same time, they operate under a finance-constrained milieu, and everybody's aware of that. So one of the levels of granularity of our total healthcare expenditure model is we report expenditures by payer type. So how much of the total healthcare cost is exerted by Medicare and by Medicaid and by commercial payers, which we here at the Insurance Department regulate about 45% of the state's commercial insurance markets. But what's noteworthy is that you can see from year to year how each of those lines of business, the public payer to the commercial payer, changes in terms of their share of cost driving to the total healthcare expenditure in our state. And it's fascinating that upon undertaking this endeavor, we did not expect to see that much change from one year to the next. But because of obvious changes in federal policy and state policy, plus economic forces, there's a lot of movement between those areas. And that may be hard to understand how to operationalize that into some useful policy examples for our legislature. But we have a keen eye on that. And, we're hoping that our legislature has interest in that so we can give them some insights on their important rulemaking processes.
So what's the future for the model? What are you hoping to accomplish? We spoke a little bit about having more data to track, but what else are you hoping to see from the future of this?
Yeah, when we initiated this process, standardization was a key feature. There, as I mentioned before, other states, Massachusetts, Rhode Island, Connecticut, Maryland, some states out in the West, they measure total healthcare cost. We actually iterated their methodology for an important reason, for extra state comparison. So to compare across other states, what is growth like in other states? And we would control for other factors like geographic variations in inflation and economics and things like that. But we have a standardized methodological approach to doing that. That was very important to us. One of the things that we'd like to do better with this year is getting more robust service category specific measures in two key markets, New Hampshire Medicaid and the Medicare Advantage markets. They're substantial cost drivers. They're of public health and healthcare policy interest. And we weren't able to get service category specific measurements for those lines of business. And as a result, the healthcare dollar that we report, noteworthy, is for the commercial markets. We aim to actually have 4 permutations of the healthcare dollar next year. One of them is the total healthcare dollar that includes all markets. Then by market type, commercial market, and then the Medicaid market, and then the Medicare space market. We aim to have a healthcare dollar for each of those for state residents to look at. The supposition is that they won't vary that much from each other, but that's what observational data analysis is all about. We get the data, and then we ascertain whether or not they vary versus try to predict what might happen using reference measures.
Dr. Jason Aziz, Director of Health Economics, thank you so much for joining me today.
Thank you for having me, AJ.
So be sure to check out nhhealthcost.nh.gov for the report, as well as many other free resources for Granite Staters, policymakers, people in the health field. There's a lot of very important information there that people should check out, especially this brand new total healthcare expenditure model. We will be doing a lot more on this in the future, so definitely keep an eye out and subscribe to our YouTube channel to learn more about the future of this very important data that we're putting together and putting it to use. You've been listening to A Matter of Insurance presented by the New Hampshire Insurance Department. If you have any questions or concerns about your insurance coverage, be sure to contact our Consumer Services Division at 1-800-852-3416, consumer services at ins.nh.gov, or visit insurance.nh.gov.